Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating case study that offers a beacon of hope for treating canine cutaneous epitheliotropic T-cell lymphoma, a rare and challenging form of cancer in dogs. This case, documented in the Journal of the American Animal Hospital Association, explores the successful use of Verdinexor in achieving clinical remission in a dog diagnosed with this aggressive lymphoma. Our story begins with a 5-year-old spayed female pit bull terrier mix. This dog presented with multiple dermal nodules that had rapidly developed over a 2-week period. These nodules, varying in size from 2 to 13 millimeters in diameter, were scattered across her head, neck, trunk, and pelvic regions. Concurrently, the dog exhibited signs of anorexia and lethargy, leading to noticeable weight loss. A month prior, the same dog had a solitary dermal mass removed from her dorsal neck. Histopathology identified it as a cutaneous histiocytoma, and the recovery was uneventful. The dog was also being treated for chronic atopic dermatitis with cyclosporine, prednisone, and monthly locavetmab injections, a regimen that had kept her skin condition stable for a year. Upon examination, beyond the dermal masses and mild pododermatitis, the dog's physical condition appeared unremarkable, with no peripheral lymphadenopathy. Initial diagnostic tests, including a complete blood count and serum biochemistry, revealed a mild elevation of liver enzymes, likely a side effect of chronic corticosteroid use. Cytologic examination of fine needle aspiration samples from the masses indicated a round cell neoplasm. Further aspiration cytology of the superficial cervical lymph node showed a reactive population of immune cells, but no evidence of neoplasia. Chest radiographs were clear, while abdominal radiographs showed mild splenomegaly, which was confirmed by abdominal ultrasound. Splenic fine needle aspiration samples showed normal to mildly reactive splenic lymphoid tissue without neoplastic cells. Initially, based on the histopathology of the previously removed mass and the presence of multiple cutaneous lesions, cutaneous histiocytosis was suspected. The dog was started on doxycycline and niacinamide to combat this presumed condition. However, 1 week later, the dog's condition had not improved. She continued to lose weight, prompting a change in diagnostic strategy. Marginal excision of 2 dermal masses was performed to obtain a definitive diagnosis. Histopathologic examination revealed a non-encapsulated, highly cellular round cell neoplasm infiltrating the dermis and subcutaneous tissues. The neoplastic cells were arranged in sheets and nodules around adnexal structures, displaying characteristic features such as indented nuclei, stippled chromatin, and prominent nucleoli. The presence of marked anisokaryosis and anisocytosis, along with binucleate neoplastic cells and a high mitotic figure count, pointed towards an aggressive neoplasm. Immunohistochemistry further characterized the neoplastic cells, revealing strong immunoreactivity for CD3, CD18, and I1, but no expression of E-cadherin. Given the multifocal nests of these cells in the epithelium, the neoplasm was classified as cutaneous epitheliotropic T-cell lymphoma, or CETL. With the definitive diagnosis of CETL, doxycycline and niacinamide were discontinued. The dog's existing medications for atopic dermatitis, prednisone, cyclosporine, and locavetmab, were continued to maintain her quality of life, despite the contraindication of cyclosporine with malignancy. Treatment with Verdinexor was initiated at a dosage of 32.9 milligrams per square meter, or 1.2 milligrams per kilogram, administered orally twice weekly. Just 1 week after starting Verdinexor, the owner reported significant improvement. The dog appeared to feel better, was gaining weight, and, remarkably, the cutaneous nodules had completely regressed. Over the subsequent 6 months, the dog continued to thrive, gaining weight to the extent that the Verdinexor dose had to be increased to maintain the recommended dosage. The dog experienced only mild side effects, including inappetence and intermittent vomiting, which were effectively managed with meropitant. Regular monitoring of complete blood counts and serum chemistry revealed no significant abnormalities, except for mild to moderate elevations in liver enzymes, consistent with chronic corticosteroid use. At the time of this report, the dog had remained in complete clinical remission for 17 months and was doing well, with no Verdinexor-associated adverse events. This case marks the first documented successful treatment of CETL in a dog using Verdinexor. The rapid resolution of skin lesions and the sustained clinical remission are particularly noteworthy, especially when compared to historical treatments. Studies involving other treatment protocols, such as Lomustine, have reported significantly shorter median response durations and survival times. While Verdinexor has shown efficacy against canine multicentric/non-Hodgkin lymphoma, its use in treating canine CETL or other extranodal lymphomas had not been previously reported. Verdinexor functions as an orally bioavailable selective inhibitor of nuclear export. It targets XPO1, a protein responsible for transporting proteins from the cell nucleus to the cytoplasm. By inhibiting XPO1, Verdinexor prevents the export of proteins involved in tumor cell growth, leading to the retention of tumor suppressor proteins like p53 within the nucleus. This ultimately induces cell cycle arrest and apoptosis in tumor cells. The differential effect of XPO1 inhibition on tumor cells compared to normal cells is attributed to the overexpression of XPO1 in various cancers. Verdinexor received conditional licensure from the Food and Drug Administration in 2021 for treating canine lymphoma. This approval was based on a Phase 2 clinical trial involving dogs with naive and relapsed B-cell and T-cell multicentric/non-Hodgkin lymphoma. However, the objective response rate in dogs with multicentric T-cell lymphoma was only 10%, with relatively short progression-free survival times. Common adverse effects associated with Verdinexor include loss of appetite, gastrointestinal upset, and lethargy. Interestingly, a similar medication, Selinexor, has shown promise in treating human natural killer/T-cell lymphoma, a rare and aggressive form of non-Hodgkin lymphoma. A recent study reported that Selinexor, combined with an anti-PD-1 antibody, led to complete responses in 3 out of 5 patients with relapsed/refractory NK/T-cell lymphoma who had failed prior treatments. This case report suggests that Verdinexor could be a valuable therapeutic option for canine CETL, a cancer known for its poor prognosis and limited treatment options. However, the authors emphasize the need for future prospective studies to gather more information on its biologic activity and long-term tolerability in a larger population of dogs. In conclusion, this case demonstrates the successful clinical treatment of canine CETL with Verdinexor, resulting in a sustained complete remission of over 17 months with twice-weekly treatment. While further research is warranted, clinicians may consider Verdinexor as a potential treatment for canine CETL. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.